the medical world changes, the nursing exam changes. Questions are designed to determine whether or not the test taker can think critically with patient care. Clinical judgment plays the biggest role in the new next generation NCLEX. NCLEX Next Generation Explained. Full overview in under 10 minutes. Nursing students are feeling overwhelmed by the new NCLEX Next Generation, and thousands have failed the exam. After this video, you'll know exactly what to expect when taking the NCLEX Next Generation. Now, NCLEX has been updated to the Next Generation NCLEX, also known as NGN, since April 2023. If you're feeling overwhelmed by the changes that are taking place, you have come to the right place. I will be going over the new Next Generation NCLEX question type as well as the scoring system. Let's help you prepare to pass your exam by going over the frequently asked questions and the exam updates. So, let's start with the first question. What is the purpose of Next Generation NCLEX? The NCLEX is designed by the National Council of State Board of Nursing, also known as NCSBN. Every 3 years, the NCSBN makes changes as needed in order to determine the competency of nursing graduates. Passing the NCLEX confirms the ability to make safe clinical judgment and provide competent nursing care for patients. These questions are designed for the entry-level nurse, which can be measured based on case studies or standalone questions. So the next question is, why is Next Generation NCLEX changing? Because the medical world changes, the nursing exam changes. Questions are designed to determine whether or not the test taker can think critically with patient care. Clinical judgment plays the biggest role in the new Next Generation NCLEX. Imagine if you were the patient. You would want your loved one to be taken care of by a nurse who has demonstrated the ability to provide competent clinical judgment. Becoming that nurse that is ready to make the correct clinical decision regarding patient care starts with passing the NCLEX. So, when did the Next Generation NCLEX begin? As of April 1, 2023, nursing graduates will be taking the updated NCLEX, which is the Next Generation NCLEX. It does not matter when the test taker graduated. Whether the nursing graduated in 2015 and has been retaking it, or in 2023, every test taker will be taking the Next Generation NCLEX. The old NCLEX version will no longer be administered. Successfully passing the Next Generation NCLEX is required to become a licensed nurse. So, are both the NCLEX PN and NCLEX RN affected? Yes, both the NCLEX PN and NCLEX RN are affected and have been updated to this Next Generation NCLEX. The next question is, what is still the same about the exam in Next Generation NCLEX? The types of questions. The test taker will still see the same question format that was presented in the old NCLEX. These include questions such as multiple choice, which is the most common type of question. However, other question formats include select all that applies, fill in the blank, audio, video charts, and so on. The Next Generation NCLEX uses computer adapted testing, also known as CAT, which has not changed. The following questions are based on your ability to answer the question correctly. If the question is answered correctly, then the next question will be more difficult. If the answer is incorrect, then the next question will be easier. The ideal situation is to be given high-level questions to demonstrate nursing competency. The computer algorithm is designed to give less easy questions, as it would not evaluate whether or not the test taker is truly ready for the nursing world. The computer will decide whether the test taker passes or fails the NCLEX using one of the 3 rules. So, the first rule, 95% confidence interval rule. The NCLEX will stop providing additional questions once the computer has determined with 95% certainty that the test taker is above or below the passing rate. So the second rule, the maximum time. The maximum amount of time allotted to take the updated NGN is 5 hours, which includes breaks. If the test taker has answered enough questions to be at or above the passing rate, the test taker passes the NCLEX. However, if the test taker has answered too many questions incorrectly and is below the passing standard after the time runs out, then the test taker fails the NCLEX. And then the third rule. maximum length. If the test taker reaches the maximum length of the exam, then the 95% confidence interval rule will be disregarded by the computer. If the test taker is above the passing standard, then the test taker passes. If the test taker is below the passing standard, then the test taker will fail. If you want to get more information and prepare yourself for the NCLEX, be sure to hit the subscribe button below. So, now let's discuss what are the changes in the next generation NCLEX. It is understandable to be feeling overwhelmed by the changes in the next generation NCLEX. Just to take a deep breath. Remember that you did make it this far. So let's just go over each change, one change at a time. So the first change, NCLEX is now titled Next Generation NCLEX, which you've been hearing me say over and over. With the April 2023 launch of the new NCLEX, the exam has been titled Next Generation NCLEX to create less confusion between the two exams. So the second change, questions are more difficult, emphasizing clinical judgment. So the NGN was designed to evaluate the clinical judgment in nursing candidates and the readiness to enter the nursing world. It is essential to determine which information given is or is not relevant. The test taker must make a decision on what to prioritize and what the most desirable outcome is. The third change, new type of questions are on the exam. Let's go over the 5 question types that are being added to the next generation NCLEX. Extended multiple choice. Ooh. These are select all that apply questions, but with additional options. While this sounds more complicated, partial credit can be given if the answer is close to correct. This is similar to the real world where nurses are presented with multiple options, but must determine what is the best course of action. Extended drag and drop. Think of your typical drag and drop, except there will not be an equal amount of choices to drag to the correct answer. There will be more choices and not all the choices will be used. Close. Drop down answers. To complete a sentence, a drop-down list of possible answers are provided to complete a sentence. A second drop-down list can be provided in the sentence, and the test taker would select the answer that would best complete the sentence. The drop-down list can be placed in a table or sentence. The drop-down list could be words or phrases. Enhanced hotspot. A report is provided and the test taker will have to determine what action needs to be completed after being given the report. It could be a medication chart or a lab value. The test taker will select the answer by highlighting words or phrases, matrix or grid. It is similar to a select all that apply question, but it is a grid of choices to select from that is similar to an Excel spreadsheet. The test taker would select an answer from the column provided. You may be asking if some of these questions already exist, and they do, but a new format of these questions have been provided. We'll go over the fourth change, which is the new scoring system for the updated NCLEX that includes partial credit, which I didn't get, by the way. Previous nursing graduates were not as lucky, me, since they were stuck with the dichotomous scoring system. Either the answer is correct or none of it was correct. The possible points are 0 or 1. If a select all that apply question had 3 answers that were correct out of 5, and the test taker selected only 2 of the 3 correct answers, the entire question would be considered incorrect. The new NCLEX polytomous scoring system now includes partial credit, which can be assigned on a positive or negative scoring, and the dyad or triad scoring. The positive or negative scoring involves earning 1 point for each correct response and losing 1 point for each incorrect response. The total score is based on adding the total amount of correct responses. If the total is in the negative, the final score will remain at 0. Dyad scoring system is when the test taker receives 1 point for answering both questions in a paired set correctly. Triad scoring system is when the test taker will receive 1 point for getting the cause correctly and another point for answering the effect correctly. If all 3 questions are answered correctly, then 2 points are given. Standard questions such as multiple choice, hotspot, fill in the blank will remain 1 point each. Partial credit scoring is provided in multiple response items. So the fifth change, number of scored questions have been updated. So the next generation NCLEX has a minimum of 70 questions to a maximum of 135 questions. This is always changing. Previously, NCLEX test takers had to answer questions as high as 265 questions. Then as the exam evolved over time, it dropped down to a maximum of 130 questions. Now it has evolved to a maximum of 135 scored questions. There will be a total of 15 unscored questions that will not count towards the scoring system, but will be used to collect data for future exams. Based on the minimum length exam, the test taker would sit through 52 standalone questions and 3 case studies. Each case study is presented with 6 questions. Test taker can sit through additional questions if the computer determines that additional questions are required to evaluate the nursing clinical skills. And last question, what can I do to prepare for the NGN? It is essential to prepare yourself for the next generation NCLEX. QD Nurses is one of the valuable resources you can use to get yourself ready and prepared. Come and check us out, subscribe, and click the link below to get 160 free digital flashcards. Don't forget to click the red subscribe button below.